Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Okay, doctors, what I want to talk about today is releasing the patient after your injury care. So, you're done with care. Your patient is done. The way you release your patient can either gain you referrals, it can gain you respect, and gain you status, or it can lose all of that for you. So it's actually pretty important, and a lot of doctors don't really think about, well, what happens when you release the patient? Now, the obvious thing, I've been in the chiropractic market for years and years and years. I don't think it's different in the physical therapy market. Anybody that manages or maintains their body has better health. So you want to attempt to get the patient to look long-term ramifications to improving their health. If you're looking at, in chiropractic, you're looking at the fact that you want the patient to go on and continue to maintain their spine, to continue to do things that would help to improve their spine. And routine chiropractic adjustments have been shown to do just that. So you're talking to the patient at the end. Now, you should have already set the patient up for release of care. If you're doing a great job in your office, and I have a Smart Injury Doctors program, we actually help the patients, we help doctors to actually give patients information out, pass it information out in the form of booklets, in the form of information they can read, in the form of email sequences, where the patient is going to be introduced to the idea that long-term supportive or maintenance care is a good idea for the spine. Now I'm going to add to it, the doctors you already should have been talking about most injuries to the spine are spinal ligament injuries, and spinal ligament injuries are permanent injuries. They cause an instability, and anything that's unstable is prone to erratic or unpredictable behavior. They are the number one cause of accelerated degeneration, and patients that actually can do things to improve their spine long term are going to improve their health. They're going to, help to avoid chronic pain scenarios. So you should have already been talking about this to your patient all the way up. The best way to release a patient is you've already communicated for 2, 3, 4, or 5 months, whatever it is, about what it is that you do and what's the importance of not only their corrective care, but long-term types of care. So you may have already had, let's say you have an excessive motion test, and you've already said to the person, look, you've got severe excessive motion due to ligament damage here. That means that you are a patient that can't miss visits. You're a patient that has high risk for long-term residual complaints, and also patients that have this type of a condition often require some form of long-term care just to maintain the health of that area of their spine. Now, have you said anything that's not true? No, absolutely you have. You've just said the total truth. So anybody that takes care of their teeth throughout their life has better teeth. Anybody that takes care of their spine throughout their life has a better spine. Anybody that takes care of their body routinely throughout time has a better body. Plenty of examples of it. I don't think I need to sell anybody on the concept of it. So the one thing, so you should have already set your patient up through simple communication, through simple materials, so that they know what they have and they know what they can do to help to maintain. They know they have exercises, or they have things that they know that they can do to help maintain their spine. Those are educational materials that you've already done. Now you're maybe making a recommendation. I know in my private practice, I used to recommend that patients see me a minimum 4 times a year for the next 2 years after they went through a treatment program of injury care with me. And was that covered by insurance? Sometimes it was, sometimes it wasn't. Didn't matter. It could be cash. It doesn't matter. I would just say, look, and this is what I'd say to you. Doctor, what you have to realize when you're releasing a patient in care, and I realized this a long time ago, the patient has been under continuous care, right? So you really haven't made a judgment, or nobody's really judged, hey, what happens to the patient when they haven't had an adjustment in 3 months, or they haven't had any treatment in 4 months, or they haven't had any treatment in 6 months? What are they going to be like at that point? Research, if you're research junkies, which I like research says that their condition is going to degrade. Without continuous care, their condition is going to degrade. That's been in a number of different studies. When maintenance care of chiropractic was tested, that was found. And also, the only other research where I was found, and you can Google search this stuff, you can look it up, is in the CBP area. I think they were the first practitioners to show those that align the spine. So those patients that had spinal alignment improvement, when they were queried 2 years after their care, 2 years after their injury, I can't remember if it was their care or injury care, but after their care, they continued to make improvement, whether they saw the doctor or not. Whereas when there wasn't spinal corrective care, realignment care, and there's only a couple of techniques that actually do that and focus on it. And this podcast is not about the benefits or which is better. It's just saying if you don't do that kind of care, research shows that the patient has a tendency, once care has stopped, their results start to degrade and they start to have the condition come back. Now, that's also the leading cause of chronicity, right? So spinal conditions are the leading cause of chronicity. So the patient just needs to know that. You just need to educate them on that. Now, you don't need to say, hey, we didn't do any kind of corrective care with you and you could have chose a corrective care chiropractor, maybe it had better results. That's not what I'm saying. What I'm saying is just know in your lane where you are. And when you release a patient, release them with the idea. Now, here's the main kicker. Release them with the idea that they've been under current care and that if the condition starts to come back, it's not because the care didn't work. Because that's what a lot of doctors forget to talk about. They forget to tell the patient what they may experience post-treatment. And so when they experience it, they think, especially in the personal injury market, they think, okay, this didn't work. Damn, I went through all this chiropractic care, all this physical therapy care, all this combined care. I went to the pain management, all this care. And, everybody got paid, everybody made money. And I've got this condition that's now come back and it continues to cause me troubles. And their thought is that it did not work, when it worked actually perfectly. It's just that they need to maintain their own condition. They have a permanent condition now, and they need to do some things to help maintain it. Now, there's a lot of things they can do. They can lose weight. They can do dietary changes. They can do exercise changes. There's all kinds of life modification things that are very beneficial that they can do. But let's say they're not doing any of those, and let's say that they don't have good, healthy habits. They should maintain their spine. So when you're talking about it, though, the easiest way that I've ever learned to talk about it is to tell them the truth. Tell them the truth of exactly how things are. And when you have injured your spine and you injured the ligaments of your spine, long term, most patients will require some form of long-term care in order to help maintain their spine. And I've always said to patients, look, if you saw me 2 times a year for the next 30 years, and you had 60 visits over those 30 years, you're going to be far better off than the person that doesn't have any care, waits 15 or 20 years. And this is general. Do I have research to back this? No, this is just from me being in clinical and have under my own. I mean, I've been adjusted since I was a kid. Since I was as early as I can remember, I was adjusted. So I have a lifetime of what you would call, I guess, maintenance care, elective care that I've chosen to do. And I've also done care programs because I've been injured. So I have a lot of experience with it, and I'm speaking to you from my experience. So those that do a little over a long period of time usually are far outweigh or far out benefit those that do nothing and then come in when it's really bad. Those are the ones that require a lot of care and usually at a lot of expense. So, you just want to tell patients the truth when you're releasing them. It's not hard, but my advice to you is to advise them exactly what they're going to experience. So when they experience it. So if I say to a patient, look, if your neck pain or your headaches start to come back, I don't want you to think for 1 minute our care didn't work. It's normal. Remember what I talked about? The fact that there was ligament damage and it causes an instability, and instability is anything that's unstable is prone to erratic or unpredictable behavior. Yes. Okay. So if you hit this and your headaches start to come back, your neck pain start to come back, don't for a minute think our care didn't work. It worked perfectly. All you need to do is get back in for a treatment or two, and it'll restabilize that instability generally. So you don't have to go to, any other doctor. You don't have to try to search what's going on. You just come right back in. Now, doctors, if they hit that problem, and they hit that 3 months, 6 months later, the first thing they're going to think about is what I talked to them about, and my status is going up, right? I also, if I've done a good job of communicating back to them through regular emails or newsletters or things along that line, then generally, what are they going to do? They're going to call back in. They're going to schedule for an appointment. But the biggest thing they're not going to do is they're not going to go, that treatment didn't work, or therefore I shouldn't refer any other injury patient into that center. That's the biggest thing that you're avoiding when you release your patients at the end of care well. Doctors, that's what I wanted to talk about today. Short, sweet, and to the point on these podcasts. I hope something I said here just helped you. If you've got any questions, call us at 800-940-6513 or look us up at smartinjurydoctors.com. If you want more free resources or more educational programs that I do, you just go to Facebook and look at Smart Injury Doctors Practice Building Success Secrets. Join our group. It's free, and you'll get more education. Doctors, again, short, sweet, and to the point. I hope to see you on the next podcast. Thank you.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.